What's up YouTube? Dr. McIntosh with Health and Performance Center. Wanted to hop on here and make Impingement Part 4. Enjoy. So this is Impingement Part 4. Again, I am Dr. McIntosh with Health and Performance Center. So the objectives for today. Basically, I want you guys to understand why. When I refer to understanding what specifically, why do we rehab tendons? What is the importance of that? And why do we choose certain exercises? So, number one, why do we rehab? Well, tendon health is very important. And this video is going to primarily focus on tendons. The next video will be focusing on muscle. However, tendons are very important, and oftentimes impingement involves the tendon of the rotator cuff, and we need to understand that. So here is two pictures. So focus on the top picture, which says healthy tendon. So this is what a tendon looks like in your body. Has basically very similar to a muscle cell, where it has a bunch of smaller units inside of itself. I've highlighted two things. So on the top where it says healthy tendon, I've highlighted type 1 collagen. On the bottom where it says tendinopathy, I've highlighted type 3 collagen. That's important later. So, tendon repair. How does this repair process happen? Well, you need to understand a few things. The picture in the bottom left is the green circle, the good circle. I put that there on purpose. And this is basically how it happens. So the tendon absorbs force. You partake in some sort of exercise, whether that be running or jogging or weightlifting, and force is placed upon the tendon. That's a good thing. It's supposed to happen. Then from that force, you get a tiny bit of damage in the tendon, and the structure is altered slightly. Now, when there is an altered structure in that zone where there's a little bit of damage, the type 1 collagen is replaced with a sort of weaker type 3 collagen, right? Think back to that picture from before. The healthy is mostly type 1, the unhealthy has a lot of type 3. So the normal process is the tendon is damaged, it is filled in with type 3 collagen. Over time, it will be replaced, this is a normal process, with type 1, and then the tendon is healed. So what happens if you don't allow the tendon to fully repair? I.e., you stress the tendon, the type 1 collagen gets replaced with type 3, and you stress it or damage it again before the type 3 temporary collagen has been replaced. Dun, da, 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 you have tendinopathy. Well, now what? So, I want to stop here and say an important note is that tendinopathy is not always painful. It's super common, and over half of people have this, and they don't even know they have it. What they do is they take ultrasounds and they look at your tendons, and about 50-ish% of people have tendinopathy, and it doesn't hurt at all. And that's what I want you guys to understand, is that it's not always an issue until it becomes an issue. So we covered diagnosis in the past video. Now we're going to kind of cover recovery, how to recover from tendinopathy. Number one, determine your current level of fitness. That is things like how often you train, how intense you train. This can be broken up into sets per week. What type of exercise? Are you an athlete? Are you a weightlifter? Are you a swimmer, etc.? Number two, determine your pre-pain threshold. This is very important in my opinion. And we need to figure out how long into your training sessions until your tendons become painful. And then number three, the last step of the recovery process, is we need to appropriately inflame the tendon. This is a perfect diagram. This was made by Jill Cook. So before you guys get confused, look right in the center where it says normal tendon in a rectangle. There's a black star. Normal tendon. So on the right is the green cycle from before. You have an optimized load. The tendon is stressed. It replaces the damaged zones with type 3 collagen. It strengthens it and replaces the type 3 with type 1. And you have a normal tendon. Now, if you have an excessive load, here's where we go into the very thick red arrow on the left. You have an excessive load, you go into the stage that's called reactive tendinopathy, where now you're not allowing that tendon to fully heal. Once you are there, you need to follow the green arrow to get back to a normal tendon. You need to appropriately load the tendon so that it will heal correctly. Now everyone stop and look at the top circle where it says stress shielded. This is hugely important. You absolutely do not want to take completely off of some type of activity or load. If you do nothing, the tendon is going to degenerate actually. So that's a huge contrary opinion in most people, but this actually, the science is very supportive now. You do not want to rest if you have a tendon issue. So next, exercise selection. This is sort of a culmination of all the 4 steps that you want to work through, and the sort of aggression of which you work through each of the steps is up to discussion here. But a great place to start is with isometric exercises. It stresses the tendon just enough to where you can start that green cycle of adaptation. A good place to start is sets of 30 seconds. For example, find a position that stresses a particular tendon and start in a position that does not have pain or has a tiny bit of pain, and hold that position against force for about 30 seconds. And 2 to 5 sets of that is usually a good place to start. Once you get comfortable in the position of little to no pain, that's when you go into what I call the pain angle, the exact spot in the range of motion that causes the pain, and then do isometrics at that angle. And now once you're at that point, 30 seconds might not be enough. You might have to go to 45, up to a minute, even up to 2 minutes to get the intended effect. After isometrics, you want to work towards high repetition, low weight, shortened range of motion sets here. We don't want to be going through full range of motion, because the full range of motion causes compression at the level of the tendon, and normally that can be too much stress at once, so in the early stages. So we're looking for high rep, being 15 to 40 repetitions of an exercise, a low weight with 2+ sets. It's up for a little bit of discretion there depending on your level of fitness. Once you can get out of that stage to where those exercises are very manageable and you're almost completely out of pain, that's when you'll push to the full range of motion training. And the idea here is to regain full range of motion, or whatever range of motion you want to have, and really push harder every rep, every set towards that range of motion. After that is what we call the energy storage and release phase. This is the very end. This is end stage. Mostly this is for athletes, people that have some sort of fitness expectation or goal. This is where you start to get into plyometrics and sport-specific loading. So here is the pretty simple TLDR of impingement part 4. If you have a tendon that is in the tendonopic stage, number 1, you want to stress the tendon. You want to inflame it to cause adaptation. Number 2, you want to give it 1 up to 3 days rest to allow that collagen turnover to happen. And then you want to repeat. And you want to do this for as long as you can until the tendon is healed. And you want to go through the 4 stages that we covered on the last slide. Isometrics first, high rep, low weight sets in a shortened range of motion, then push to full range of motion sets, then push to the energy storage and release exercises. So in summary, tendinopathy can be caused by either excess or insufficient load, right? Resting a hurtful, a painful tendon is a bad idea. You want to have an appropriate inflammation process to make that heal. Number two, tendinopathy is caused by the incomplete collagen turnover process, right? The type 3 has not been able to be replaced with the type 1, so now you get a tendon that's mostly type 3, which is an unorganized, it's not as tough, it's not as strong as the type 1, and you want it to be mostly type 1 collagen. Number two, an appropriate inflammatory response is needed. One thing that people really love to do is take a lot of anti-inflammatories and ice. I would say that's probably a bad idea because these are all things that suppress that inflammation that we actually want and need to heal the tendon. And the last slide, the last point here is tendons are very, very stubborn. They heal very slow. It can be very annoying and a very tedious process, but I want you guys to take the slow path and picture yourself 6 months from now and picture the end goal of where you want to be and not where you are now, because it's easy to get bogged down by the rehab process and not be able to see the finish line of where you want to be. So thanks for watching, guys. Next video we're going to talk about the muscle side and how muscles recover and what to do for muscles. So again, guys, thanks for watching.